Welcome, my name is Helen Youssef. I will be discussing my lesson plan. This semester, I am at Georgian Court Meridian Health School of Nursing. The course I am mentoring in is Evidence-Based Nursing Care of the Adult 1. In this course, we are talking about med-surgical nursing for the adult client. The target audience includes 24 traditional junior BSN students. The class consists mostly of female students with 4 males present. Ethnicities are varied and include Caucasian, African American, Hispanic, Asian, and Jewish. The primary language for everyone in the class is English. The topic of discussion for the class that I am teaching is the assessment of endocrine function. This builds upon the anatomy and physiology that all students have taken prior to this class. We go over coordinating care for patients with pituitary disorders and coordinating care for patients with adrenal disorders. Students bring to class the medical surgical nursing, making connections to practice textbook. This is a requirement, and the authors are Hoffman and Sullivan. All students have the textbook. The lesson takes place in a GCU classroom. There is a projector with sound available for all the PowerPoint presentations. Students sit in individual desks. Each student is put in pairs of 2. All the desks face towards the front of the classroom where the teacher is instructing. Each student brings with them their own laptop and has connection to the GCU Wi-Fi. They bring up the PowerPoint presentations via Blackboard. There is adequate lighting in the room and the temperature is adequate as well. The theoretical model used for the course in my lesson is that of evidence-based nursing care. And with evidence-based nursing care, we are using the best research evidence, patient values, and clinical expertise when creating a care plan that is specific to the patient and meets the patient's needs. I will now further discuss the details of my teaching plan. When figuring out how to plan my lesson plan, I did look at the course description, the course goal, and that is to prepare the students to effectively use the nursing process to plan, implement, and evaluate effective, collaborative, and culturally appropriate evidence-based plans of care that meet the bio and the physical needs of their adult patients. Looking at the course learning outcomes, they are specific to the course goal. So the students are integrating knowledge and principles and concepts that they've learned in previous courses. They're learning to prioritize patient needs using the nursing process. They're using appropriate intra and interdisciplinary referrals across the continuum of care. They're exhibiting the necessary technical skills to perform nursing procedures required for delivery of safe and effective nursing care. This course does have a clinical component. The students are learning to plan, implement, and evaluate health teaching plans for patients across the adult lifespan. They're using knowledge of the legal and ethical issues related to the nursing care of adults and professional nursing standards to assure provision of moral and ethical nursing care of their adult patients and families. They're accepting responsibility and accountability for personal and professional behavior, and they're developing, evaluating, and modifying therapeutic communication strategies used to implement the nursing process in care of adult patients. Prior to the start of every class, students are expected to come prepared by reviewing the PowerPoint presentation. The students received the PowerPoint presentation 1 week prior to the class. They are expected to do the assigned readings. For my lesson, the Hoffman and Sullivan chapters 40 to 42 were assigned. In my PowerPoint, I left links to different YouTube videos that reviewed many of the key concepts in the endocrine disorders that I discussed. For the evaluation methods, I used both formative and summative evaluation. For the formative, I engaged the students by asking different questions throughout the presentation to bring upon discussion. I use multiple choice connection check questions after every major concept to assess student understanding. And I also used student engagement by giving my own personal experiences and encourage students to talk about their observation in clinical setting. So if they had a patient that mimicked one of the disorders that we discussed, we went into further elaboration of that disorder. And for the summative evaluation, I used a Jeopardy game, and that was to split the class into 2 teams and review the key concepts. And students have the link to this Jeopardy game that they can review on their own time as well. In total, my lesson was 90 minutes long. My lesson learning outcomes were specific to what I was teaching. And with the topics that I was teaching, my goal was to describe the location and function of the different endocrine glands. This was a general overview. To correlate diagnostic examinations to endocrine function, to assess the changes in the endocrine function associated with aging, to implement the nursing process to plan, deliver, and evaluate care to patients with pituitary and adrenal disorders, to discuss the multidisciplinary treatment modalities used for patients with pituitary and adrenal disorders, to plan therapeutic communication techniques related to pituitary and adrenal disorders, and prepare patient teaching as it relates to the pituitary and adrenal disorders. My content was split with various times. I put more focus onto any of the nursing assessment interventions and patient teachings. I used the PowerPoint slides as a generalized guide, and I always had a reference to the textbook. After discussing the general overview of endocrine disorders, I became more specific in my lesson plan and focused on pituitary disorders and adrenal disorders. We learned about the epidemiology of pituitary disorders, the clinical manifestations, diagnostic considerations, and medication management. And then we focused on the nurse's role in developing a comprehensive plan of care to treat patients with pituitary disorders. I used a chart to organize the nursing management. After discussing the pituitary disorders, my general outline was similar when discussing the adrenal disorders. Again, we discussed the correlating clinical manifestations, the diagnostic considerations, medication management, and again, I used the chart to organize the nursing management of the patient with the adrenal disorders. Throughout the PowerPoint, again, I used different connection check questions as well as visual images to better present the information to the students. In the end, we used the Jeopardy game. It's an interactive game to review the key concepts, and the students were able to use the link at any time. I encouraged them to review the Jeopardy game again prior to their final exam. Students were very receptive to the game, and I think that that was a great way to add fun into a lesson. I hope you enjoyed my lesson plan. Thank you for your time.